Hello and welcome all to this very special Facebook live session, which we're also streaming as our podcast episode of Hello Apollo. Thank you for joining us once again, and thank you for your continuing patronage. We've had viewers in even larger numbers as the weeks have progressed, and that gives us a lot of confidence that we are actually providing and getting good, useful health information right down to where you need it the most. And this week is no different. I'm delighted to be joined by Dr. Ekta Puri, the Chief Clinical Psychologist at Indraprastha Apollo Hospitals, who will be discussing with me a very important subject which is bothering a lot of people, whether it is children, whether it is college going students, or even parents and the lay public alike. So, before I get to the subject of our discussion today, which is on exam stress, let me welcome Dr. Ekta Puri. Dr. Puri, welcome to our joint Facebook Live and podcast episode.
Thank you, Karan. It's a pleasure to be here, and I wish we could help all the people around us in dealing with the stress.
Absolutely. And, as you know, we've hit the exam season, whether it is board exams or final exams for schools, right from, primary, secondary, high school. Some colleges are also undergoing various semester evaluations and other sorts of exams, which are actually going to start and go up till the summer, whether it is for entrance exams and others. But more specifically, our subject of discussion today is exam stress relating to school students. So before I get into various aspects of it, first and foremost, what is exam stress?
Okay, so I think there is nobody in this world across the globe who has not experienced what we call as exam stress. I'm sure Karan has also gone through it, so have I. And before I start, I want to make it very clear that exam stress is not for people who have not studied at all and now they are stressed. It is equivalently true for people who are achievers. I think they experience it even more. And for people who have not studied the whole year and who want to study last minute like I used to, right? So exam stress is a feeling of being overwhelmed by the upcoming exam, and wherein we just keep thinking, we don't want to do anything. We just keep thinking about, oh my God, it's boards, oh my God, how will I do, my future, my this. And we spend so much of energy in just thinking that we don't land up doing anything, is what is exam stress, right? And it is experienced by one and all. So that is primarily what it takes. There are a lot of physical manifestations of it. We can't sleep, we can't eat, we are restless, or we are oversleeping, or we are overplaying on the games. We don't do anything. We don't, either some people also overeat for that matter of fact, or, avoid what is upcoming. So it's something which is very commonly seen. We see a huge inflow of people at this point in time, especially children with headaches, stomach aches, fever, coughs, cold, and they all boil down to the fact that they are just going to be facing the exam.
Right. And, like you said, it's an overwhelming feeling of being overwhelmed. So is it a problem that emerges in the mind and then has physical manifestations, or is it actually something which is happening bodily? Because that will be useful for a lot of people to actually separate the two out.
Okay, so I think mind is stronger than the body. So it starts in the mind, right? Because we start seeing it as something which we can't deal with, and we start putting too much of pressure on it, right? So, the mind starts playing this game where we start seeing the worst case scenarios, that what if we fail, what happens, what if I don't get an admission, if I don't make a life out of myself, how will I make the money? So it is always definitely the mind first. It is the thinking pattern which affects your body's physiology. Your adrenaline becomes so high that it actually goes down, your performance goes down. So like we all know that stress is a double-edged sword. We cannot avoid it. It will be there. How you approach the stress is actually whether we lead to the manifestations or we will use it for our benefits. So some people who just get overwhelmed start getting these physical manifestations, which is because of the biochemical changes that happens in the brain in terms of serotonin becoming low, adrenaline going way high, that it starts to interrupt our performance. And so we start having the physical symptoms. So a relaxed mind is a relaxed body.
Right. So, मतलब अगर इसकी शुरुआत देखें, so it can be in the mind, but then there are some physical manifestations. So, आप डॉक्टर एकता, a lot of people come to you, I'm sure, and they seek advice. तो क्या symptoms होते हैं जो आप ultimately diagnose करते हैं कि ये exam related है या exam stress related है? ऐसे कौन से symptoms हैं जो parents को या students को they should look out for?
So, a lot of parents first go to a pediatrician, because they don't think it is stress, right? So anything which is not being able to deal with medication, if you have a headache and you take your Combiflam, paracetamol, it doesn't get better. It keeps repeatedly occurring. You cannot digest even one bit of food, you keep vomiting, or you keep going to the loo, you have stomach upsets. So anything which is stress generated will not respond to physical treatment because we are not removing the root cause. There is no infection in your body, but you are too stressed. So then we get these referrals from pediatricians when they try to analyze and figure out that there is nothing wrong in the stomach, there is nothing wrong in the head, everything is done. And the child still continues to experience issues. So then we club them and say that this is functional or this is because of stress. It is stress related. So then they come to us. So we gently rule out all physical issues, stomach upset, stomach infections, headaches, whatever. And then it becomes functional.
Right. So very clear symptoms that you can see, and obviously then you sort of separate out what it cannot be, and then arrive at this diagnosis. But is it true that some children or some people who are undergoing examinations fare better? And if so, what are they doing differently?
Okay. So what they do differently is, like I said, it's a double edge. Some children use it for their betterment, right? And two, it's your mental makeup. Your first step is to understand that no matter what you do, you cannot avoid it, right? Mm-hmm. So when we can't avoid something, we need to strategize it and put it in a way on how I can use it to the best of my ability. So the only difference between people who feel less stress and people who feel more stress is that their personalities and their attitudes is a go-getter to say that if I am in a trouble, I am going to deal with it. I will make the best of it. I will do what I can to make the best of my situation. Maybe I've not studied, maybe I've not done things, but instead of wasting time, let me utilize what I have right now. So it's your mental perception, it is your attitude, it is your personality, which either you will keep totally drown in it and get symptoms, or you will emerge a winner.
You spoke about perception. But it could also be because of external reasons or the external environment, right? I mean, things are so competitive. People are always talking about, topping exams. There are newspaper advertisements of some people doing very well. How much does, society and external environment also play a role in increasing stress?
No, I totally agree with you there, Karan, because I think the moment the child is school going, the teacher also asked my 7-year daughter in school today, what do you want to become when you grow up? And my daughter came back and said, Mama, I don't know what I want to become. But I said, it's okay, bacha, you can take time. But it is the environment, it is the children, it is the school, which is the primary place where a child recognizes competition. And, when the teacher tells you, are you doing better? Why are you getting 9? So it starts there. To the parents, most often than not, now we are working parents. The mother is working, the father is working, and they keep reminding the child of how much effort they're making to put you in the good schools and things. So their expectations from you are skyrocketing. Every parent wants an IAS officer, doctor, engineer, and simply you have to do well. Everything is negotiable, academics is not. So your perception about it develops from the very beginning, that you have to do well in life. Academics cannot be ignored. You have to perform. And the school, the environment definitely plays a role. That day my daughter was again looking at the newspaper and she saw pictures of these toppers, from the various exams which are being portrayed as a full page ad. And she asked me, Mama, would you want to see me there? And I didn't know what to say, because as a mother, I probably would really wanted to say, yes, beta, I want to see you there. But I said, no, beta, I just want you to be happy and follow what you want to follow. But I guess, Karan, you're very right. It is us as parents, it is environment, it is the teachers, It is what is gets portrayed in society as you need to be academically very bright. You need to study abroad, Canada, UK, London. So you have to study. That instills the pressure in the child.
Right. So that is the external environment. But also, as you said, many people take it differently. Many people have the ability to handle that stress and some don't. At what point, and this is from the view of the parents, let's say, should they come and seek professional help? I mean, when does this natural stress or normal stress become pathological or something that requires a doctor's intervention?
I think I need to really communicate this to parents, and I think this is probably a right platform. That most parents come to us at the nth time.
Yeah.
So right now, since the exam starts Friday, I right now got an SOS call from a patient who said, "Ma'am, my daughter wants to see you. See her anytime, morning, night, day, but you have to see her." So, you come to us when it's really beyond any help, right? When your child is not studied, he's not sleeping at all, he's on the mobile 24 by 7, and he's irritable, and now everything is out of your hands. And then they expect some miracle to happen where the child will start to study, take the exam, the depression will go, he will sleep better, which is just not possible. You need to start recognizing the soft signs of depression way earlier, right? So April, March, when you start your new sessions, during post this thing, if you feel your child is not interested, he's not wanting to study, he's spending too much time outside, you have to address it that time. When you see your first term exams going very bad, you see the second term exams going bad, deal with it then. Deal with it when it is small. Don't deal with it when it becomes so overwhelming and big and you are looking for these quick answers to say, nah, he's a psychologist, so everything is just going to be perfect and tomorrow he's going to be facing the exams confidently. We are humans. We don't have the magic wand to run and say everything will set into place. So don't push it till the end. We are normal human beings. We don't have horns on our head. Bring your child to a psychologist. Your child is not crazy, but they all need to talk. We all need to understand that as working parents, we are not able to give them that kind of time. We are not able to focus on their needs and their emotional requirements. So if somebody else can, then why not?
Right. So it's very important to normalize the conversation and also accept that these things happen for a variety of reasons. Seek professional help by seeing how your child is doing during the entire year, not just during exams. Very useful advice. But I like to move to solutioning now. I mean, exams are going to be there. They probably would increase for a few people, especially who are getting into the competitive examination schedule now. So first, for students, let's talk about high school students. How should they cope with this natural stress that is coming their way?
Okay. So, like I said before, also, step one is to embrace a positive attitude. We first need to probably spend some time with ourselves. That doesn't mean your time is being wasted, right? Because not that you're going to be studying 24 by 7. So just spend 15, 20 minutes, half an hour by yourself, take a few deep breaths and tell yourself, this is something which I cannot avoid. I can do it. I have the capacity to do it. I will do it. So that's the first. Second is plan. Pick up all your subjects, have a strategy, right? So I always tell all my students, you do not need to do your 100% if you are really short of time and you cannot cover everything. The CBSE, ICSE, every syllabus gives you weightage to your topics. See what weightage is there. Spend good half an hour, 1 hour strategizing, planning on how much you know, how much is left, what is it that you can do to make it better. Step 3 is to first start with, to get yourself motivated, is to start with things which are easier. Because if you start with something which is tougher, we will again get caught into the spiral of I can't do it and a sense of failure. So you generally start with things which are easier, which can give you a motivation to be able to face things which are more difficult. Step 4 is to take help. If you don't understand anything, don't spend 2 hours trying to solve that one maths problem. You rather just take help. And today, Google will really help you with solutions to anything that you want, or probably a teacher or probably a friend. So look for help, take solutions, organize, have a positive attitude, coming down to the typical gyan that everybody listens to, the 8 hours sleep, which is very essential at this point in time. Eating regularly is very essential at this point in time, because generally people tend to eat a lot of sugar, which gives them into a sugar rush, and a high sugar actually makes you more sluggish rather than the sugar rush, which people think you're going to be very active and energetic. Beyond in time, it again slides down and makes you very sluggish. Why the sleep is important and why people keep telling you about sleep is because when you sleep is the time when your brain actually organizes whatever you have learned, and it puts it into a place where you can retrieve it tomorrow when you need it. But if you don't sleep, the brain does not get the time to actually put it into organized parts where it can be retrieved better. So that is the reason children who study the whole night before the exams and do not revise are people who actually do worse. So getting 8 hours of sleep is very essential for the brain to organize things. One more important tip that I would like to give everybody is that revision is more important than studying. So after a point in time when you organize yourself, even if you've done 80%, focus on revising it rather than trying to complete the 100% that is there, because it is only with revision that the all that you have learned will shift to a long-term memory. Otherwise, everything gets stored in the short-term memory of the brain, and the short-term memory is limited capacity. And when it is limited capacity, it will go out. So if you do, rather instead of focusing on doing 100%, do 80 and revise it so that it gets stored in your long-term capacity, and in the long-term memory, it is easier for you to retrieve it. It is a permanent storage, right? Do take your breaks, do watch your favorite TV shows, go for a walk. Don't keep talking about exams all the time, kal po de, kal po de. Just take it easy. It is just one exam. You've done exams for whole of your life. It is no different. So you actually have to tell yourself, you're a champion at it. Right. So take it easy. It's just an exam. It's nothing more than numbers.
Right. So you spoke about very useful advice and how to decompress, with walks, balanced diet, and sleep. I'd like to bring in technology, and increasingly children are studying using technology, whether it is through screens or gaining information through things like Google or YouTube, other places. Now, is technology important for de-stressing also? Or would you, I know a lot of parents who are actually moving all the electronic gadgets out during exam times because they consider it as a distraction. What is your advice for the middle path?
I think, this is the huge thing. Well, while we were in COVID and all the children were doing online, the parents said, oh, this is too much of screen time. But the moment child said, I want to play a game, they said, no screen. And when it was online, you said, okay, 10 hours, here's the iPhone, do it. So, but I guess moderation of everything is what is needed. Right now, we cannot start monitoring the child on screen, because they have other things to deal with. Technology is definitely useful. Google has a lot of answers. YouTube has a lot of answers. But I think it's very unfair for you to tell the child, use technology for studying, don't use technology for entertainment. That's not being very fair. But if you give your child half an hour, 40 minutes of watching their favorite show or playing their favorite game or doing something using the screen, I don't think it's going to kill them. But I think it's more when you say don't do it, it's this thing, then you will straight away hear an answer to say, when I have to study, you are very happy to give it to me. When I want to watch that show, you don't want to give it to me. So let's not put ourselves into that spot, and let's allow them controlled, monitored screen time for their fun and for their benefit.
Right.
Because
go ahead.
So we really cannot tell them to use things when it benefits us, and we can't tell them to stop when it is for them. So let's be generous.
Right. Let's move to parents and parenting. Now, if you have a child who's going to be taking exams, what is your advice to parents? How should they approach time that they're facing a big exam for their children along with them? So, what is your advice to parents?
I think what most parents needs to understand is that mental health is most important. Your child I have so many dropouts from IITs. who I see all the time. I have so many people who dream was IIT and couldn't do it and are depressed, who are on treatment. You have to understand, if your child is mentally healthy and happy, he will succeed in whatever he picks up. It does not really have to be a socially acceptable, influential IAS, IFS field. And in today's time and world, the stressors are ever so much. We already have so much going on. Let your child choose what they love to do. If they pick up a field which they really love to do, right, and then they follow it, they will definitely be on top of it, right? So we don't have to put all our worries and anxieties on the child. Do this, because this is us. This is not them. It is our need that they should study well and get the 90%. Right? Sometimes if they have a 90% and they're sitting in front of a psychiatrist popping in antidepressant pills, I don't know how useful is that 90%. So I think you, as parents, you need to understand that don't try to fulfill your own needs and dreams from your child's eyes. Let them live their life. Let them choose what they want to choose. Nothing is a number game today. There are people who have hardly studied and are CEOs of companies. And there are people who have studied so much and yet are sitting in front of a psychiatrist or a psychologist popping a pill. Right? So it's your choice. I really think we need to provide a supportive, positive environment to the child. Be their support to say, you do your best, rest we are here. If you don't get good marks, we'll pick up something else. Nothing in this world is end of the world. Nothing, no marks can limit you from success. Success is not about the crores you earn. Success is about how happy you are, how relaxed you are, what is your quality of life, what are you doing, and that is what is more important. So we need to shift focus, from churning out the IAS and the IFS and the engineers and the doctors. We need to focus on churning out happy individuals. Today, this year, I'm sure Karan would also agree to it. The WHO, this year was the mental health.
Yes.
Because now the WHO rating says 1 in every 4 is going to have not diabetes, not sugar, but depression, which is very alarming and very, very, very scary. And we are now with time seeing children as small as 5 years who are suffering from clinical depression, which I think is very sad. So as parents, we need to take a pledge to say that I'm going to raise happy, satisfied individuals who love to do things and enjoy life. And whatever field they pick up, they will make their money to enough, that they eat well, sleep well, and do things well, rather than making money and giving it to a psychiatrist.
Yeah. Well, such a wonderful message there about acceptance and about looking at options, opportunities, and becoming happy in the process and not chasing things which are somebody else's dreams. So that's very important. We are drawing this conversation to a close, but before we do that, I know you work with a lot of schools also. What would your advice be to school administrators and teachers about how they should sort of normalize exams and help in reducing exam stress?
I think teachers play probably equally important role as parents. Like I said, I have these twin girls who join school, and I recognize that how much important is a teacher's word to a child, right? They ridicule a child, the child comes back home crying, right? So as teachers, you might have your school impression. You might have a school grading to say, oh, so many of the children in our 10th grade scored 95%. And you might have so-called targets, maybe, to have achievers, this many achievers, this many IITians, this many this. But, life has to go beyond it. I think teachers need to, I understand you need to discipline, and I understand that you really need to tell your child to study. Yet at the same time, don't make it into a situation where you use very harsh words with the children to say that, oh, if you don't get marks, you're good for nothing, and you'll do nothing in life, and this and that and the other. So the teachers need to be very careful about the kind of vocabulary they use for their children. You need to encourage. Not all 5 fingers are same. Some child might not be oriented in maths. They might be very good at auditions. They might be very good at dancing, music. You need to recognize the strengths and weaknesses in the child and encourage them to focus on those strengths. Right, rather than focusing on the weakness, which becomes the normal protocol to say maths ki tuition laga lo, Hindi ki tuition laga lo, usme aap kharab ho, usme aap ye ho. So the attitude generally is to sharpen your weaknesses. Whereas if we focus on the fact that, let's strengthen our strengths, right? Like rather overcoming your weaknesses, right? So let's not do that. Let's look at a child in totality. Everybody is not born to be academician. You can just be doing other things and yet doing well. So teachers, schools, administrations, instead of focusing on your school's image, instead of saying 90% of the children of our grade 10 and 12 were above 90%, let's not focus there. Let's not commercialize things. Let's try to be human. Let's try and say that, okay, let's generate happy people. That's happy children, because you have a huge role to play, a huge role. School has a huge role to play. So I guess they need to recognize that.
Right. No, I think that's very important. So we just drawing this conversation to a close. What is your parting advice to anybody who's got an exam either tomorrow or in the coming weeks? What is your parting advice to all the young students who are out there listening and or may be interested in getting some advice on how to handle exam stress?
Okay, don't stress about examination stress. Take it easy. It's a chill pill. You've done it in the past. You will do it again. We've all done it. We've all studied last minutes. We've all unplanned. We've all partied, and then suddenly recognized we have had exams. We are all human beings. The only advice is make the best of the time you have. Don't waste time fretting over what you could have done and how you could have done things differently. Plan, be a smart planner, see how you can get the maximum from what you have. And just remember, we've all been those last minute studying, those 3 days in between the next exam, but the most crucial ones is Mr. One day we will still waste and the rest 2 days we will study. Is all a very normal protocol. So like I said, don't stress about examination stress, don't stress about 10th, don't stress about 12th. Give a pat on your back to say, we've done it for 9 years, 10 years, 12 years, we'll do it again. So just take it easy, and all the best is just a 10th and just a 12th and just a college exam. Life doesn't end. Numbers are not important. Being happy, positive is much more important. So I would like to say, just enjoy, chill pill. This too shall pass.
Right. Dr. Ekta, it was a pleasure to have this conversation. Time always flies. And I have gone back even calmer and de-stressed listening to all the wonderful advice that you had to share with us.
Thank you so much, Karan, for inviting me here. It was a pleasure to be a part of this.
That was Dr. Ekta Puri, the Chief Clinical Psychologist at Indraprastha Apollo Hospitals, giving her advice on exam stress. And for all of those who are going to be taking exams or have their exams started, we wish you all the very best. Remember, it's important to come out happy and also pat yourself on the back for the effort that you've put in. And for parents, as Dr. Ekta said, if there is an issue that you think should be seen by a specialist, please do reach out to us. You can reach out to us through direct messages on our social media platforms or call our board numbers. We'd be happy to fix an appointment with Dr. Ekta and make sure that we unleash the potential of your child to do well in life and, as she said, to stay happy. So till the next episode, keep studying hard, but don't take that stress and stay happy. Thank you.